At the same time, we would also have an understanding to the types of tooth replacement that you could think of. There are different options. So one thing you should bear in mind, right, whenever you're thinking of replacing any of your teeth, whether the upper part or the lower part, one thing that should come to your mind first is, which of the options am I going for? So tooth replacement is not just a one-way thing. There are different options when you talk about tooth replacement. There are options you can go for. And of course, the medical practitioner from the dental department would help us understand which of these options is best and how do they also work. We would also look at some other factors around it. If at all, are there implications, are there complications to this tooth replacement? We would also talk about the accessibility. We will talk about the cost implication. We would then also look at the maintenance, because these are three major key areas for people who have replaced one teeth or the other, right? So there is a place of cost, there is a place of accessibility. How accessible is it today in our society, in our community, in our nation, Nigeria? How accessible is tooth replacement? And at the same time, what are the requirements for maintenance? We will talk about that by the side. And then lastly, we would perhaps wrap it up with some of the risk factors, the complications, like I told us earlier, before we have the preventive measures too as well. Right? Prevention, like they say, is better than cure. So we would of course also talk about the preventive measures. All of these and more we will talk about today on the issues on IKD 106.1 FM. And don't forget, you can be a part of the conversation by calling us on our studio lines 0904 081 1061 or 0904 082 1061. I am Okwemi Adebambo. I'll be your anchor for today. Stay with us as I go on this very short break. When I return, the issues continues. Special thanks to General Hospital Ikorodu for making this happen every Thursday. Is giving us representatives from various departments. And like I told us, a representative from the dental department will be talking to us this morning as regards tooth replacement. With us in the studio this morning, we have Mrs. Sunny, who will be talking to us as regards this conversation. Good morning to you, ma, and thank you for joining us in the studio.
Good morning.
Good to have you in the studio. All right, so this morning we're talking about tooth replacement, and then let's start this conversation. For people that are at home listening at this time, so they can have a clear understanding to what tooth replacement is. Ms. Sonny, can you help us understand what does it mean when we say tooth replacement? What is the meaning of tooth replacement?
Okay, thank you.
Yes, please.
When we're talking about tooth replacement, it's something that is very deep, and it's everybody that needs it. So far you are missing some teeth. Even if it's just a tooth, you have to replace it. Now, I would like us to understand what is tooth replacement.
Okay.
But before going to that, I would like to tell us about denture.
Okay.
Dentures means an oral artificial teeth that replace missing tooth, either one or two or more, or maybe so a patient that does not have teeth at all. So it could be by accident, it could be by sickness, it could be anything that could cause it. So don't lose hope. It could be by operations, depend on what cases, what applies to you that cause your issue. Now, going back to replacement,
Yes.
we have different type of replacement. Tooth replacement, we have fixed appliances, we have removable tooth replacement.
Okay.
And when we're talking about the fixed one, we're talking about porcelain, we're also talking about zirconia. And also, we also have veneer, but I won't be discussing about veneer much because it's very high, so much expensive. So we don't really have people coming for that veneer because of the price. So let's come to the porcelain and zirconia. When we're talking about porcelain, that one is made of casting of a metal, starting from casting of a metal, then to the ceramic. It contains the two material. It contains metal and the ceramic. So talking about the zirconia does not contain metal. It's very lighter, but it's very rigid than the porcelain. But according to the talking about the aesthetics, the beauty. If you want more aesthetics, that you smile, that will be very close to the natural teeth, then I will advise you to go for zirconia. Now, don't lose hope because you're having missing teeth.
Okay.
To talk in the public, to talk to your friends or talk to your boyfriend, your girlfriend. So people are very, very shy to talk when they have that kind of issue. We have it there in the various types. And there's cheap one there also, when we're talking about denture, the plastic one. So it's not expensive. Depend on your pocket. If you can avoid the zirconia or the porcelain. Now, why are you replacing your teeth? It's very, very important. You have to know that one first before even banging. You know what you don't understand, what you are not educated about. It will be so strange. And you must be educated before you apply for that kind of thing. Or you say, let me have denture because I've seen the person that is wearing denture. It's as if they said, I can have my replacement. Yes, but you have to understand that it's a foreign body. When you come for it, you want to get your denture, either the removable one or fixed. They are all foreign body. They are not the original teeth, the natural teeth. So when you have the plastic one, it may give you something like you are feeling strange. Something comes in that is not there before. Hope you are getting me. So something there, there's something that is not there before, and you are putting it. Already you have something strange in your mouth, which is foreign body. When you put it, when it is being ready. So when you fix it, you might not get the taste of food when you are eating with it. It does not matter. Some people find it very easy to eat with denture. Very, very. They will even tell you that since you have done it for the past 5 years, they have been wearing it, they don't even remove it. And they are eating with it. But some people, when you do it, some patients, when you construct the denture for them, they will be telling you that I can't feel my taste again. I'm still saying something like, this thing can you? No, that's denture. It restores the gum, the associated tissue. So it has its own 4-component part. What are we talking about, the four-component part? We are talking about the tooth, we are talking about the plate, we are talking about the collet part, we are talking about the flange. So I would like to show you how it looks so that when you come for your replacement, it won't be something that, I don't know, this is how it is. Hope you understand.
Yes, yes.
Hope I'm getting your question right.
Yes, please.
So,
and if you're listening to us today on the issues, we're talking about tooth replacement, and we have Mrs. Sunny with us in the studio from the dental department. Now, for those of you that always have questions around the tooth replacement, what does it entail? What are the requirements? How does it work? We have a professional with us in the studio this morning, and she's helping us through the conversation. Now, some of you listening right now might not be able to get this one, but because of the purpose of online, the social media, because of the purpose of the video, you might be able to get it through that channel. Maybe we will share that out later on. But Miss Sunny, please, you can go ahead.
thank you. So this is a patient's mouth. This is representing a patient's mouth. And meanwhile, the patient is having 2 missing teeth. So this one is not tooth, it's teeth. Because once it's 2, 3, you start counting. It's no more tooth. That's why you call it teeth. So this person replaced 2 teeth. And now, and the same thing, something is appearing in between the teeth. So in between the teeth, some people call it, in Yoruba, they call it a G. So don't be so much afraid that I don't want my look to be changed. Yes, we can restore everything. I told you earlier. I said denture, when we construct it, the reason why we construct it is that to restore back your smiling aspect, your aesthetics. Yes, the aesthetics, the beauty. That means if you have the asthma, we call it the asthma in my own profession. That's what the dentists we call it, the asthma. Hope you are getting me.
Yes, please.
So, but people call it open teeth, the gap teeth. In Yoruba, we call it a G. Definitely, if you have it, I will restore it back. It will surely appear. Are you getting it?
Yes,
So it will surely appear. So don't worry about you. Even if it is the porcelain that you are going for, if whatever that you want us to restore for you is being restored. And then you want it to just look like exactly about the as your lecturer.
As it used to be.
So I will definitely do it.
Now, some people will come out to tell you that, oh, immediately you lost one of your teeth,
Yes.
you know, you replace it with another one like this ones you have here in the studio immediately. Some will come out to say, no, not immediately. You have to wait for some days, for some weeks before you replace. Now, as a dentist, the professional that you are, which is exactly the correct one? For those that are listening now, is it immediately after you've lost your teeth or after waiting for some time?
Thank you.
Yes.
When we're talking about something that you want to get immediately, you know, some people, they don't like appearing inferior or something that they have lost their smile.
So
and
there's
they are
low
going for
self-esteem.
interview. No, thank you for that one. And they just baffling about that. You know, you don't need to baffle. We are there to restore it. If you want to get it immediately, we call it immediate denture. It can be done immediately.
Immediately the person
Yes,
lost the
you
teeth.
just have to wait, exercise patient. You know it's not magic. So once your impression has been taken, which is your measurement, and what do I mean by that immediate too? Immediate could be meaning to you that someone that appear now, that I want to restore his denture, his missing tooth or teeth, and you know, that is what you asked me now. But another form, in another direction, there is another thing that we call immediate as well.
Okay.
It could be someone that is having toothache, or the tooth is being mobile, maybe it's shaking. You know, when you come and you want to remove it, yeah, right? And you don't want to go back home like that. You want to replace it. Definitely, we call it immediate denture. It's been done, but before it could be done, the dentist will remove the tooth that has been pained, and after they remove, maybe okay, it will be done. The impression will be taken before the extraction being done. So immediately the patient come in, you tell us what you need, and you want to get your replacement immediately. It can be done. So definitely the impression will be taken before the extraction.
Okay.
So when the impression be taken, which is the measurement of the mouth, then you now go for extraction.
Okay.
So definitely, as alongside that you are doing the extraction, the dentist is removing the tooth. The technologists will be doing the denture, and as you've done the extraction, maybe maybe 1 hour. After 1 hour, maybe the blood has been stopped due to extraction. Then you have your teeth immediately. We fit it.
Is that easy?
It's very easy. It's just about money. You know, everything is money.
We will get down to the cost.
Immediate denture is very expensive. That normal duration that you come,
You
the
take your
duration you take
bookings
that
and
you
all of that,
after
yes.
1 week. So definitely it involves money. So that's it.
All right. Thank you for that one. If you have questions, you can do well to call us as we talk about this tooth replacement. Now, let's also look at what are some of the causes to adults now. You know, we know that as a child, when there's loss of teeth or tooth, depending on the numbers, either one or more, right? We say, oh, he's a small boy, she's a small girl, he's growing, that's why he's having the tooth removed and losing of the teeth. What happens to an adult? What are some of the reasons, the causes to why adults also still have loss of teeth or tooth?
Talking about the adults or the young ones, the cost is still the same thing. We don't have discounts for anybody. If you want to do your replacement, either the plastic one or flexible. Am I getting your question?
Yes.
We are talking about cost now. So either you are adult or you are still young, maybe a child, no matter how the age may be. A 10-year-old could have a denture. The adult could have a denture. Even the old ones at 90, they have their denture. But it's still the same amount. Hope I'm getting your
How
question.
affordable is it?
You can go for the plastic one. The one that I showed you now. So you can go for that one. Per one is 15,000 naira. Per tooth is 15,000 naira.
For one?
For one. So, but there is another one we call flexible. That one is more expensive than the plastic one. You know, when we are comparing plastic plates or a plastic bowl, or comparing plastic bowl with rubber bowl, so definitely there must be quality. There must be long span like that. So the life, the way that one will last, you can't compare it to the plastic. So definitely the plastic break easily, but the flexible still, you can still use it more than, I'm talking about the
Duration.
of the dentures. So the duration of the flexible is not comparing to the plastic.
Like how many days or how many weeks or how many months are we looking at?
No, it's just that when it depends on how you take care of your denture. But it's not advisable for you to to use a denture more than 5 years.
More than 5 years.
Yes.
After 5 years, it's advisable you replace it.
You replace it.
Wow.
But some people with some patients will come back, they will tell you that for past 10 years that you have made it for me, I'm still using it. No, consider that it's in your mouth, you are using it. Consider the saliva, what you take in, the liquid aspect, the fluid that we drink, the food that we eat, and also some other things like coffee that we take in, a lot of things like that. So they have things to do with the denture. It's a material, it's a foreign body, and you are using it because it's not broken. And some people will even, it's been broken, though, they will still use super glue to glue it together so that they can still use it because of money. No, it's not advisable. I can bet you with you can use it more than 10 years, but it's not advisable you use it up to 10 years.
To 10 years.
At least you can come back, you can save your money as you are using it. You have it in mind that the dentist said I need to come back. It's no matter how it's been long.
At least 5 years.
At least.
Maximum 5 years.
Maximum
5
years.
And
You have to
let's-
replace
let's-
it.
let's-
But the flexible, in terms of taking care of it, hope you understand me to duration. If you wash it in the morning,
Okay.
before you use it, you wash it in the morning with brush and non-medicated soap, definitely bacteria will not grow. Even when you are talking to other people, they will not tell you that you are having halitosis. So let's stay on that replacement. If you have to talk about the consequence, how you're supposed to manage it, I don't know, maybe I
Because
still getting
yes, we are going to talk about the
okay,
management.
let me just
Yes, thank you for that one. Let's now talk about the management. With the way you're saying it now, I've not experienced this before. I've not seen this before, and I'm in my head already thinking, oh, okay, how do they maintain these things? How is it done? What is it looking like? So can you give us an idea? Can you give us details to what a tooth replacement maintenance looks like? How is the maintenance like? Is it something that, you can brush your teeth the way you brush your teeth before, or you have to plug it off, and then, what's the maintenance like?
It's not too hard.
Okay.
It's only if you make it hard for yourself. To take care of your denture, either plastic one or the flexible.
Or flexible.
I've said it earlier. I said, once you get it, definitely we will educate you how to maintain it. Immediately it's being fixed to your mouth. So once it is being fixed to your mouth, I will surely tell you the rules. It's only when you violate it or don't take to your precautions. To maintain it, you wash it in the morning, as I've said earlier. Separately.
You take it off your mouth, you wash it separately.
Some people sleep with it. They sleep with it. Some people remove it at night. But whenever it's not in your mouth, you have to put it inside water. That's when you get a hollow plate that has cover. So you drop it inside, get water inside the container.
And people do that themselves, remove by themselves and fix themselves.
I've mentioned fixed one, I've mentioned removable one. I told you that if removable one, we have flexible. We have the plastic. I've shown you the plastic. And the flexible is also with me here. The flexible denture is also with me here. What I mean by that flexible, I said it earlier, is a little bit elasto. You can compress it and it still return back to the normal shape. But the plastic one, you cannot bend it. You cannot. It's not
the way it is.
So it's it's still the same way to maintain it. You get your container, put it inside that container, make sure there is water inside that container that has cover. So then when you drop it inside, you keep it there. Some people sleep with it, as I've mentioned.
Yes.
Some people remove it in the night, but it's advisable for you to remove it in the night.
It's advisable to remove it. Always
sleeping.
remove it before sleeping.
Yes, because if we snore, at times we, you understand when we, so by mistakenly you could swallow it. Some people swallow it.
Wow.
So it's advisable when you, before you go to bed, you take it off. So, but if you now, maybe you are tired, you now find that you sleep with it, there is no problem. It's only you make sure you wash it in the morning separately with non-medicated soap. That's where some people miss it. They thought they said that I should be washing it in the morning. Then you start washing it with toothpaste. It's not advisable like that. We also have a denture cleanser, but in absence of that, get non-medicated soap like Joy or Lux. Then you have your toothbrush separately for that. So you wash it. Make sure you wash your own mouth too, because of halitosis. Prevent yourself. Because it's a foreign body. It's a material on it. It's acrylic. It has this plate that you are saying is being formed. Is acrylic, pink acrylic. We have the one that is clear acrylic. That's one that we use for temporary bridge. For the permanent one, we have an acrylic jacket crown. Okay. We have acrylic jacket bridge. We have acrylic bridge. We have acrylic jacket crown. So those ones are made of clear acrylic. The plastic one, which is being removed, which is removable denture, that one is pink acrylic. Hope you are getting it.
Yes, please.
So the porcelain that I mentioned earlier, with the zirconia, I said the porcelain contain metal cast and ceramic. Why the zirconia contain only ceramic? But the ceramic there now, the material that one contain is being stronger than even the porcelain that carried metal and ceramic. And is lighter. You could compare that one to natural tooth. Are you getting it?
Yes, please.
So to maintain them, that one is being fixed to your mouth. The fixed dentures is being fixed to your mouth. And once it's being fixed to your mouth, definitely you wash your mouth. True. And once you are washing it together with it. But it's very expensive.
It's expensive. That's what makes it different.
They are very, very different. You cannot compare zirconia price to porcelain price. Depend on their quality. So when we are talking about the removable one that is common. Yes. Because some people will say, I wish to have that, but because of money. That's why we have this one. Very, very cheap. 15,000 per unit per tooth. So, and to maintain it, I've said it earlier. Get a container, make sure there is water in it.
You covered one.
You covered the cover container. So whenever it's not in your mouth, make sure it's inside that water.
All right, thank you for that one. We will go on this very, very short commercial break. When we return, let's talk about some of the so-called consequences or repercussions. Some people right now would say, oh, what that madam is saying in the studio, oh, it's true, but they will not tell you that it will do this, it will do that. So we want to go on this break. When we come back, let's talk. Do we even have consequences? If yes, what are they? And if no, how visible is it? We go on this break, and then when we come, the issues continues on IKD 106.1 FM. Thank you for still staying with us today on the issues as we talk about tooth replacement. This is one common activity that happens today, but not everybody knows the integrity, the importance of tooth replacement, the situations around it, the do's and the don'ts. What you should know about tooth replacement is what we are talking about today in the studio. And of course, we have Mrs. Sunny from the Dental Department, General Hospital Ikorodu, taking us through that conversation. Thank you very much, ma, for being with us. Now let's talk about the most important that a lot of people listening right now wants to know. What are the implications? Are there even implications? Let me start from there. Are there implications to tooth replacement?
Sure, because it's a foreign body. But the implication comes from the patient, not the material.
It comes from the patient and not the material.
I think I've answered that question if you follow me very well. I said failure to wash it, to maintain it, definitely there will be consequence for that. You know, something that you don't wash, it's a funny, but it's not your body. You are applying it, you are putting it. And definitely consider the saliva. I'm talking about what we take in. So it will solely have impact in that material. Are you getting it?
Yes.
So the consequence in this material, this appliance is just when you don't maintain it. When you don't take to precaution with those things that we tell you to be doing. So definitely there will be consequence. What are the consequences? I talk about halitosis.
Halitosis.
So what do I mean by halitosis is the bad odor when you talk and you hear or you perceive
the bad breath.
Yes. So that's what I call halitosis in dentistry. That's what we call it. So, and apart from the halitosis, definitely before anything could set in, the halitosis will come in first. Yes, it will set in. So definitely, when there is halitosis, definitely there will be food debris hanging around your tooth.
And that's bacteria
Your teeth,
again.
yes. The calculus will be surrounding the teeth, holding the denture that you are wearing. Even the denture, when you remove it, you will see some particles or food debris at the palatal surface of that denture, which is under. So let me clear that that term that I use. I said at the palatal surface of the denture, of the replacement. What I mean by palatal surface is under, where it's being rest to your gum. That side that is attached to the gum. That's what we call palatally. When it's upper one, the upper jaw, not lower.
Yes.
And also the lower too has its own palatal surface. Are you getting it?
Yes, please.
So the plate now is where we have to be careful enough. The outside could be neat at times, but if you check the inside, where it rests to the gum, you will see some particles on the line accumulating. So what are they doing there? They are forming bacteria already. So definitely there will be consequence.
Before we go, two more questions and then we'll wrap it up for today. On the issues, let's talk about General Hospital Ikorodu here. Right? What does it look like? There are some departments that they will tell you, oh, okay, we open 3 times a day. For your dental department, and for those that have listened to you this morning and they feel like, oh, with what Mrs. Sonny has said, maybe it is time I need to consider this tooth replacement, maybe I need to fix 1 or 2 of my teeth and all of that. What is it like? How do you operate? That is the dental department at General Hospital. Is it that they can come anytime, any day and say, I want to fix my teeth, I want to replace my tooth?
From Monday to Friday.
Monday to Friday. Every Monday to Friday.
So, I don't know. The only thing that will not allow you to, that you won't be able to get your replacement is money.
That is the only pause.
Then when you come, there are some patients like that, they have one missing tooth. They will be telling you that it's behind. That, nobody is saying it. It's dangerous. It's no good. It's not advisable.
It's dangerous.
You know, those teeth at the corner that you are talking about, that you are neglecting, when you miss it, they drift. They cause drifting to the remaining teeth.
Because there are spaces there already.
Yes, it will cause drifting. Are you getting it? So, and it also affects your dimension, the jaw dimension, both upper and lower. Something is coming up. Where you remove that tooth that you neglect, remember there is another one opposing it, close, that they kiss each other. Definitely when you remove one, the opposing, they are adjacent. Are you getting it? So when you remove it, the second one will not be glad. Because there is no control.
There is a vacuum already.
Yes. So the other one will now be coming out from the root. Trying to, as it's coming from the root, definitely is coming out. Before you know, you remove that one. It's not only that, as that one is remove it from the root, it's also affecting the abutment teeth. I mean the teeth beside. So they will be drifting. And what are you causing? The jaw will not be in proper dimension again. So don't neglect any tooth. This one is behind. Is this one that I remove at the front that you should do for me?
And this tooth replacement, it has no age limit. It can be done to a child, an adult, anybody.
It could be done.
Wow.
So it's not something that I neglect. Moti dagba. I'm now a old person. I don't need what I need again.
So some people will tell you they don't need it.
But consider your biting as well. It is when you now get to worst that patient will now be running scatter, come to the clinic and giving the dentist headache that can I have a denture? I want to do replacement. Before you know, when we now check the patient's mouth, you see that the gum, the lower jaw is already meeting the upper jaw. So where do you want us to construct that denture? Where is it going to be fit? Where is being kissed? So as early as possible, once it's being either it is behind or the front tooth, once you have a missing tooth, make sure you come to the dental clinic. We are available at the Ikorodu General Hospital. We will surely do you good.
You heard that.
Smile again. You will surely smile again.
You will smile again, and
yes,
that is Mrs. Sunny there. Find your way down to General Hospital Ikorodu from Mondays to Fridays. The dental department will always be there to attend to you if it has to do with tooth replacement or any other dental issues. Yes. Now, before we go, Mrs. Sunny, thank you for your time and thank you for joining us this morning in the studio. What will be your parting words? What will be your advice? What will be your take home for everybody listening to us at this time as regards tooth replacement? The floor is open for you to talk to people at home. What will be your advice to everyone out there?
So, the advice I will give is that whenever you're having toothache, make sure you come down to dental clinic. So as early as possible. As early as possible. So to make sure that you are no tooth is falling off. And if eventually your tooth fall off, don't lose hope. And don't rule it out that it's behind. We normally have that case. Some people will say, do this, don't do this. You're having 3, 4 missing teeth. You are telling me to do one.
Does it even make sense?
So I advise you, once you have issue with your teeth or oral, whatever you have, yes, maybe you have halitosis, before you even have, make sure you come to dental clinic, Ikorodu, because I'm sure of Ikorodu General Hospital. We are there, we are at your service.
The facilities are there.
Very, very quality. So when you come, make sure you check in dental clinic 6 months for scaling and polishing. Okay. It will prevent your mouth from bacteria. And once you do you check in, you do your scaling and polishing. If there is reasons for you to remove your tooth, don't hesitate, and don't look like I still want to pay school fees, I still want to buy ashwebi, I'll come back later. And you start using agbo, or taking someone is telling you to come beside the road and remove bacteria. It's a big lie. Rush down to General Hospital to take care of your oral health.
Thank you very much for your time, Mrs. Sunny, for talking to us today. You've heard it all from the horse's mouth. Mrs. Sunny is right there telling you to take care of yourself. Health, they say, is wealth, and that is why we have talked about tooth replacement today. Tooth replacement is possible, it is seamless, it is affordable for some of us, and then there are levels to it. There are types of this tooth replacement. All you have to do is first off get down to General Hospital Ikorodu and be sure of exactly which one works for you. The implications are only going to be there if you refuse to take care of these tooths, right? So if you're not doing the right thing as regards maintenance, then that will be on you and not on the instrument that has been added. This is how far we can have it today on the issues. My name is Okoyemi Adebambo. Until next week Thursday, same time, same station. Stay healthy, stay safe. It's a bye for now.